Imagine a delicate flower, meant to bloom in the warmth of the sun, yet shrouded by a veil, hindering its growth. This is the reality for many pregnancies affected by Central Placenta Previa, a condition where the placenta, the lifeline between mother and baby, covers the cervix entirely. This condition, while relatively uncommon, occurs in about 1 in 200 pregnancies. It poses significant challenges and requires careful monitoring and management. In a normal pregnancy, the placenta attaches to the uterine wall, providing essential nutrients and oxygen to the developing baby. However, in Central Placenta Previa, this attachment occurs lower down, completely obstructing the cervical opening. This positioning can lead to complications, particularly during labor and delivery. Understanding this condition is crucial for expectant mothers to make informed decisions about their pregnancy and birth plan. Central Placenta Previa is often diagnosed during routine ultrasound scans in the 2nd or 3rd trimester. While it might not always present noticeable symptoms, it's crucial to be aware of potential warning signs. Recognizing these signs early on enables prompt medical attention and can significantly impact the outcome of the pregnancy. Knowledge empowers expectant mothers to actively participate in their prenatal care and advocate for their well-being and that of their babies. Central Placenta Previa presents unique challenges during pregnancy, labor, and delivery. One of the most significant risks is painless bleeding, often occurring in the 2nd or 3rd trimester. This bleeding can be unpredictable and range from light spotting to heavy hemorrhage, requiring immediate medical attention. The placenta's position over the cervix also poses a risk during labor. As the cervix begins to thin and dilate, the placenta can detach prematurely, leading to severe bleeding. This condition, known as placental abruption, can be life-threatening for both mother and baby. The baby's health is also a major concern with Central Placenta Previa. Because the placenta might not function optimally, there's an increased risk of premature birth, low birth weight, and fetal distress. Understanding these potential complications is crucial for expectant mothers to grasp the seriousness of Central Placenta Previa. While the exact causes of Central Placenta Previa remain unclear, several factors can increase its likelihood. Previous uterine surgeries, such as a cesarean section or fibroid removal, can create scar tissue, potentially affecting placental implantation. Women who have had multiple pregnancies, especially those closely spaced, are also at a higher risk. Additionally, maternal age, smoking, and the use of assisted reproductive technologies have been linked to an increased incidence of Central Placenta Previa. The most common symptom is painless vaginal bleeding, often bright red, which can occur without warning. However, some women may experience no symptoms, making routine prenatal care and ultrasounds essential for early detection. Diagnosis typically involves a transabdominal and/or transvaginal ultrasound, providing a clear visualization of the placenta's location and its relationship to the cervix. Once diagnosed, the severity of the condition, gestational age, and other factors determine the appropriate management plan. Managing Central Placenta Previa requires careful monitoring and individualized care plans tailored to each woman's circumstances. Regular prenatal appointments, including ultrasounds to track the placenta's position, are crucial. Depending on the severity and gestational age, doctors might recommend pelvic rest, limiting physical activity, and avoiding sexual intercourse to minimize the risk of bleeding. In cases of significant bleeding, hospitalization might be necessary to stabilize the mother and baby. Corticosteroids can be administered to help mature the baby's lungs in anticipation of premature delivery. Delivery for women with Central Placenta Previa is almost always done via cesarean section, often scheduled electively before labor begins to reduce complications. The timing of the C-section depends on various factors, including the mother's and baby's health and the amount of bleeding. Throughout this journey, open communication with healthcare providers is paramount. Expectant mothers should feel empowered to ask questions, express concerns, and actively participate in decisions regarding their care.